Please welcome William Jefferson Clinton, founder and board chair of the Clinton Foundation and 42nd President of the United States, and Gavin Newsom, Governor of California.
Governor Newsom, thank you for joining us, and thank you for your extraordinary leadership during this COVID-19 crisis.
Thank you.
I'd like to begin with a question that was raised this week in the press when you and your colleagues out there, the governors of Oregon and Washington, said you would try to follow a joint plan to reopen the economy. And I'd like to tell everybody else in America and around the world that that should be important to them, because before this happened, California's economy was growing at 3.8% a year. That's 50% faster than the US economy as a whole was growing. So we need you back, but you can't really get back unless you know your people are going to be safe. So if you could keep in mind, we got 800 students here from all around the world, about 100 countries. They're in different situations, but they all want California back. And so what are the criteria that you and your colleagues in Washington and Oregon, Jay Inslee and Kate Brown, are going to decide will determine opening the economy?
I appreciate that, Mr. President. Let me just stipulate what you said is true. The 3.8% is average GDP growth over the last 5 years. Last year, we ran a $21.4 billion operating surplus, and we're really proud of California's growth. It's now pushed us as the 5th largest economy in the world. We talk about ourselves in terms of being a nation state. It's figurative, not literal, but it's a state of 40 million people, 27% of Californians foreign born, and we're very prideful of that. But we're also very impacted by macroeconomics. And as a consequence, we tend to do a little bit better in the good times and a little bit worse in the bad times. Well, bad times are upon us, and we're very, very cautious and concerned. 2.7 million Californians have filed for unemployment insurance claims just in the last 32 days. And so the pressure is on all of us to talk about not just health, but also the economy, and talk about the economy in the context of how that impacts public health as well. And rather than doing it alone, we're trying to do it together. I think that's the old African proverb that I heard from you a decade or two ago. It said, if you want to go fast, go alone. But if you want to go far, go together. And so we want to extend the relationship, extend the narrative of support up and down the coast here in North America, in Oregon, Washington, California, share best practices and approaches. And we've laid out 6 criteria that we believe can become best practices in terms of how we toggle from moving beyond the stay-at-home orders and then push further on more restrictive strategies where individuals will be required to do more for themselves as we start to phase in an opening of our economies.
Thank you very much. I'd like to ask about one other contemporary issue, and then we'll talk about the management of this epidemic more generally. When I saw the stories in the last couple of weeks, last week, about the dramatic difference in the impact of COVID-19 in some states on people based on race and income, I wasn't surprised that there was a disparity. I was surprised that the disparity was so deep. That disparity is much less in California. It exists, but it's less. And it's also surprisingly less in New York, even though, as you know, as the 2 biggest cities in the 2 states, New York City and LA, have discovered it's harder to social distance and harder to keep down the casualties. if you have a lot of poor neighborhoods. But the racial disparity is less. Why do you think that is? And what would you advise the federal government to do, the Congress to do, and what could we help the other states do who are dealing with these racial disparities where the mortality rate is basically 2.5 to 1?
No, it's such an important question, and it just highlights disparities that are really America's pre-existing condition, and that is the disparities in access on environmental justice as a frame, on issues large and small around income and wealth inequality in this nation, all underlie and undergird the answer to why I believe those disparities persist differently across this country. I'm very proud of the state of California. You're right. We are underrepresented for Latinos, underrepresented for Asians, slightly overrepresented in the African American community. But I think the reason we're not an outlier in terms of the extreme and the opposite direction is California's commitment to healthcare. There's simply not a state in America that is doing more to provide high quality healthcare across the spectrum. We did bring back the individual mandate as part of the three-legged stool in the state of California. We expanded subsidies into the middle class, people earning up to $150,000. We deepened subsidies for low-income workers. Just, Mr. President, in the last 3 weeks, we extended our open enrollment for the Affordable Care Act. We extended it for 58,000 individuals just in 3 weeks to capture more people so that we could provide preventative care, not just sick care on the back end, and do so in a way that's truly bottom up, culturally competent, in a way that does justice to all. That said, those disparities nonetheless persist, and we have a lot of work to do in California and across this country.
But it also indicates why the country should do more to expand access to healthcare in general.
That's right. That's right.
Let me ask you one other thing. One of the key elements in your plan to be able to reopen California, and I liked it, by the way, because you didn't overpromise. You didn't promise you could do things you couldn't, and you made it clear that unless you could do it without more people getting sick and dying, it couldn't be done. But one of the things that you have to be able to do is to track people who are positive. Where were they? Who were they in contact with? How can you hem up any recurrence of this? Massachusetts has recently announced that they're going to try to build a statewide tracking program, and they've asked Partners in Health to run it for them. And they're one of my partners in the work we've done in Africa, Haiti, and other places. But where are we going to get all these contact tracers? Should we have, like you did with California did with the Conservation Corps of young people, should we have a contact tracer corps, even if we call it something more elegant? Should we really build the first public health network we've ever really built in this country around this issue?
I think the answer is absolutely yes. And I love the Massachusetts example. We were able to learn from them. We're all sharing best practices in real time. But this is an interesting point that's often not brought up. We have tracing capacity that predates COVID-19. It goes back to SARS, measles, TB, et cetera. Tracking and tracing capacity that exists in the county levels primarily, and increasing capacity at the state level. So what we're doing is we're building off that existing infrastructure and using the tools of technology to overlay. In addition to that, we're using AmeriCorps specifically. And thank you as a champion for AmeriCorps for decades. We've been able to take advantage of that workforce. Obviously, our Conservation Corps, what we have now is called Cal Volunteers. In the spirit of Sarge Shriver, we are asking people, thousands of folks, to be part of this new corps, to get trained and to help us with the tracing, because you're absolutely right. The predicate for getting back to some semblance of normalcy is our ability to identify individuals through testing, to be able to trace their contacts, to isolate individuals that have either been exposed or quarantine people that are tested positive. And that's just going to require an army of folks and the capacity of consideration from individuals to allow for their privacy to be impacted by that kind of acuity of attention based upon where they've been and who they talked to.
Well, let me say, for the Americans listening to this, I think that the expansion of AmeriCorps is a great idea. And those who are university students will know that if you do a year or two in AmeriCorps, you acquire also, in addition to the modest salary you make, you get payment for college expenses. But, and in other countries, people who are from other countries, they still may be able to develop that. But what do they need to do this safely? That, I think a lot of young people are going to be listening to this thinking, you know, maybe I should be a community worker. But what do I need? Gloves? Do I need a mask? Do I need a uniform? Do I need whatever? Where am I going to go? And I'm more than happy to take some risk, but I want it to be prudent within this sphere of accepted public health practices.
Yeah, no, I mean, it's the right question. And that, by the way, begs many other considerations and questions that we need to raise around PPE, not just N95 masks, surgical masks, but shields, gowns, gloves, coveralls, and the like. But absolutely why the predicate for any tracing capacity is training. And in that training are the answers to that question. It's not just the intellectual capacity to understand how to do the job. It's the capacity to deliver that job at the grassroots in communities large and small with the appropriate level of protection of one's individual as well as the broader community that can be impacted. This, by the way, Mr. President, remains the foundational question, is the ability not just to trace and track, but also to test at capacity. And then moreover, if you're going to isolate and quarantine people, to have the capacity of resources to do that and a workforce that can help surge that capacity to help support those individuals with wraparound services that have their appropriate healthcare needs met as well.
Well, let me ask you something to follow up with that. Just a few days ago, you and your colleagues in Washington and Oregon announced that you were going to send some ventilators back east to places where there are more people infected because you thought you had the capacity to deal with what you would face without them because you have leveled the playing field, you've leveled the curve. Why do you think that is? What did you do that has made this less bad than the experts told you it was going to be a month or 6 weeks ago?
You know, I love to say about life, you know, life doesn't happen to you. You want to make life happen for you. That future is not just something to experience. It's something to manifest. It's decisions that will determine our fate, not conditions. And so the answer to the question, Mr. President, very directly, it was the sum total of millions of good decisions by 40 million Californians in the aggregate that took seriously the nation's first stay-at-home order and practiced physical distancing. And when they had to do essential service and essential work and go to the grocery store and get medicines, they appropriately practiced physical distancing and started to wear face coverings. And that, you saw, had a direct impact on buying us time, on stretching this curve and bending the acuity of its growth, allowed us to build capacity, build our assets, get more PPE, and 42.2 million N95 masks we've been able to distribute. And I couldn't be more proud. Today, we added another 50 ventilators we sent to Michigan. We sent others to New Jersey, Illinois, DC, Nevada, and other parts of the country. And we want to do more still as we are starting to bend this curve into a new status in terms of this epidemic. But again, I caution, we're not out of the woods yet.
Are you going to have all the tests and testing evaluation you need? Will your capacity there be enough when you want to do massive contact tracing?
At the moment, I would be speculating. In the moment, based on speculation, the answer is no. With what I know today, this has been a point of deep angst and frustration. While California has excelled in so many categories, we have not in testing. And I own that, and I've taken responsibility to do more and better for 40 million Americans that happen to live in this state. That said, we are seeing a significant increase in our testing capacity. We'll get up to 20, 25,000 tests a day in the next week or so, but we need to be doing multiples of that. We get the serology tests that are coming in, the blood-based tests. That should help in this respect. Our biggest limitation in California has been on the media and the diagnostic side, swabs, and the media to carry the swabs. So the diagnostic side has actually, or rather the specimen side, has impacted the diagnostic side of things. It was reagents, RNA extraction kits. Forgive me for confusing people, except to say there's always been one part missing. Now we're getting a handle on that. And as we move to these blood-based tests, antibody tests, as they're referred to, these serum tests, I think that capacity will start to grow exponentially. But right now, we're not close as a nation, let alone as a state, to where we should be on testing.
Well, I think that's going to be our next big challenge. Even if you get an army of young AmeriCorps volunteers to be contact tracers, it'll only work if they have the kind of masking testing that is a predicate to their success. One other thing I was going to ask is the one thing that the governors I've talked to, including several Republican governors of small states, one thing they always say is, why are we buying all this stuff in a bidding war with California and New York? And then they never say anything bad about you. It's interesting. They say, why are we doing this? This is a stupid way to run a railroad. Shouldn't we have a bulk purchasing system where we know who's going to produce what, and we guarantee them a fair price, that is, their cost of production plus a reasonable profit, and nobody bids against anybody else, and then we give it out the way you're sending the ventilators back east based on need. So,
yeah, I mean, the answer is you're right about that. They're right about that. And you're also right about California's status. Outside the federal government, this state could procure more PPE than any other state in the nation. Let me be specific about that. We just committed $1.485 billion, $1.5 billion for PPE because of our capacity to write a large check and be able to procure a massive amount of new supply. We were able to go into mainland China and help get a new factory operationalized that potentially will bring out upwards of 150 million units, 150 million units of masks on a monthly basis. And you're right that that's not right broadly, considering that's one state where we should be coordinating those efforts. Here's the good news. Governor Inslee and Governor Pritzker and others, we brought their procurement folks, working with our procurement folks, to start to coordinate and collaborate a little bit more. I don't want to overstate how well the collaboration is going, but it's an indication that if you don't like the way the world looks when you're standing up, stand on your head, go local. At the state level and the local level, there are partnerships and capacity building that is taking shape, that is organically answering the question. But we sure as hell, forgive my language, Mr. President, should have started there.
So what would you do if, like, the governors of 5 tiny states called you and asked you if they could ride along in your purchasing group?
Well, they're already doing that, and we're all in. We're Americans first. We happen to have 40 million Americans living in the great state of California. My responsibility is to do everything I can to meet need. And if there's an acuity of need, we are going to do everything we can to turn our support and our power in that direction. But we are, I think, in a position as we move into the next phase of this pandemic and we see flattening of curves across this country, able, I think, to take a step back and really formalize these one-off relationships and start organizing at a subnational level, at the gubernatorial level and the local and regional level a little bit more effectively. So I think you're going to see in the next few months that capacity really take shape and those efforts advance even more than they have so far.
That's great. I'm very grateful to you for that.
Thank you.
What do you think? You have a lot of companies in California who are participating in this race to find, if not a cure, at least a treatment that will keep people out of the hospital, off the ventilator, and out of death. And if we do that, that's more than 90% of what we have to do. I think the likelihood of that happening is greater just because of all the research that was done on Ebola, as well as cholera, AIDS, a lot of other things. There's a lot of stuff going on. Do you believe that you have any sense that we'll get any kind of breakthrough in the next few months? And does California have the ability to produce anything they find in massive volumes?
Yeah, I think it's the right question. And by the way, this is one of our six key indicators in terms of our ability to begin to toggle and start pulling back on our stay-at-home orders, the capacity for therapeutics to be delivered and distributed as well as manufactured. A lot of the manufacturing happens here in the state of California. And as you know, Mr. President, California is the birthplace of biotech, life science, bioinnovation, biotherapeutics, Genentech in 1979 in partnership with the UCs and Stanford University. We're blessed because of your support going back decades, the work you did on genomics, the work down in Southern California and San Diego, where so much of this research and development is being advanced. So we have companies like Genentech and Gilead and others. They are manufacturers, not just headquartered companies in the state of California. We've got a team. We meet virtually every single week with representatives from these companies and research institutions and academia, getting the latest on these trials, not just therapeutic trials, but also vaccine-related trials. Some of the real work, some of the most exciting work that's being done on vaccines is happening here as well in the state of California. It's an area we don't want to overpromise, and we don't want to start promoting particular products or regimes, but it is an area of some optimism as we move forward, and the capacity for the states, Massachusetts, Texas, so many parts of the country to really be front and center, tip of the spear in terms of the therapeutic side of this is very exciting.
Let me ask you one other question, and then I've got a wrap-up question. I'll give you a chance to close because I know you're busy. But what non-medical challenges are you facing? Do the food pantries have enough food? Are the deliveries, I work with Jose Andre and World Central Kitchen, and we've made thousands and thousands, tens of thousands of meals available around my library in Little Rock. And he just opened up an operation in Oakland with your friend, the mayor there. So I know you've got the people that do this, the Lord's work all the time, but I keep reading that a lot of places are going to be short of food. So how are you on that?
Not only short of food, but short of volunteers helping distribute the food. We sent our first cohort of the National Guard out on a humanitarian mission, not an enforcement mission, to help supplement the food banks and to get in the cranes in the back of the factories to help with logistics and to help with the distribution. There's nothing more heartbreaking, particularly in the United States of America, a nation so well resourced, to see these long miles of cars backed up. It also underscores, again, the original sin in this country, and that is income, again, and wealth inequality, which was growing and growing and growing before this crisis. And if there's any moment to reflect and pause on reimagining the future to substantively address not just growth, but inclusion at the same time, I hope it's now. But let me just say on the issue of inclusion, I'll tell you what is so ennobling, and you're a perfect example of that, the work you're doing here at CGI in partnership with Chef Jose, is all the moral authority that's being expressed every single day. We spend so much time talking about people in positions of formal authority, people with titles, governors, mayors, congressmen, presidents. But at the end of the day, the most extraordinary leaders are people like Chef Jose that don't wait to be something to do something. And what he has done at scale, not asking for permission, just forgiveness to meet this moment, is really inspiring. And I think perhaps the most important lesson that I learned in my life, and I hope a lesson that can be absorbed in the young people watching, is their capacity to be leaders and not wait around again for position and title, but to exercise your capacity in your neighborhood by just lifting out and reaching out and help lift somebody else up. And I think that is what is so inspiring at this moment. It gives me just absolute hope and optimism. And I don't say that lightly or flippantly. I mean that at the core of my soul. I have been just mesmerized by the sense of communitarianism and commonwealth, a recognition of the other at this moment. If we could just capture that spirit as a throughput out of this crisis, sky's the limit in terms of what we're capable of doing as a world community, not just as a nation.
Thank you. That's what I always love about California, and what I hope the country will model and the world will model. I'll let you go, but I thank you for what you said, and I hope the students listen to your answer. And we talked about making contact tracing safe enough with medical equipment. We got to do that for volunteers. Even we're having trouble at my library keeping our volunteers up enough for the demand for the meals. So if all of you who are listening to us today and watching us, if you want to do something, start first in your home in America or somewhere else and make sure people have enough to eat. And then if they don't, what you can do to help. Thank you, Governor. Thank you for your magnificent leadership, and Godspeed.
Thank you, Mr. President. Honored to be with you today.
I'm Katrina Villas-Cisneros, and the future is fighting for human rights.
The future is fighting the opioid epidemic.
The future is fighting climate change.
And protecting natural resources.
Tackling domestic violence.
Empowering refugee women.
Zero discrimination and equal job opportunities for everyone.
Equitable access to education.
Tackling substance abuse.
The disaster resilient world.
The future is empowering the next generation of leaders.